Greetings everyone. You are watching Info Videopedia with me, Shilpi. In today's video, we will cover some of the fundamental aspects of pharmacokinetics. We will cover how the different routes of administration impact the drug absorption and action. We will understand the key differences between parenteral and enteral routes of administration. We will also understand how the different routes of administration impact the Cmax and Tmax using real-life examples. Also, we will understand the first pass metabolism, that is, the action of the liver in filtering the drug out. We will also understand the aspects of bioavailability, that is, how much of the drug actually enters your bloodstream. So, let's get started. In the word pharmacokinetics, pharmakon means drug and kinesis means movement. Pharmacokinetics refers to the movement of the drug within the body, from the moment it enters to how the drug is absorbed, distributed, metabolized, and eventually eliminated. Pharmacokinetics refers to what body does to the drug. Absorption, distribution, metabolism, and elimination are the key processes describing how a drug moves through and how the drug is processed by the body. Absorption is the first crucial step. It's the process by which a drug moves from the site of administration into the bloodstream. Understanding absorption helps explain concentration maximum, time maximum, bioavailability, and it's critical to the drug action and the dosing schedule. The process of absorption is governed by mechanisms such as passive diffusion, facilitated diffusion, and active transport across cell membranes. Before we take a deeper dive into the process of absorption, let's take a quick recap. A typical pK graph is represented by concentration versus time. Y-axis represents the concentration of the drug, and x-axis represents the time. We covered the pK graph following an oral route of administration. After the tablet is ingested, it gets slowly absorbed into the bloodstream from the gastrointestinal tract. The concentration of the drug in the plasma rises from 0. It reaches a peak value, and the peak concentration is called Cmax or concentration maximum. The time taken to reach Cmax is called Tmax or time maximum. The portion under the curve is called area under the curve, and this represents the total drug exposure. For educational purpose, we can divide the pK curve into different segments 1, 2, 3, and 4. Segment 1 represents the absorption phase, where the drug concentration slowly rises in the plasma and reaches the Cmax. This can be represented by a right-angle triangle. Segment 2 represents the distribution phase, where the drug gets distributed into the tissues. This can be represented by a trapezoid. Segment 3 and 4 represent the elimination phase, and this can also be represented by the trapezoid. Area under the curve is the sum of all these areas, that is, the right-angle triangle and the subsequent trapezoids. Area under the curve is used to calculate bioavailability, that is, the proportion of the drug that reaches the systemic circulation. For practical purposes, we use softwares to measure the area under the curve. Let's understand the scientific classification of different routes of administration. Routes of administration are broadly classified into two categories. One is parenteral route of administration, and the other one is enteral route of administration, depending on whether the gastrointestinal tract is involved. Parenteral comes from the Greek word para means besides, enteron means intestine. So this is typically besides the intestine, that is, intestine or the GI tract is not involved. These are injection-based route of administration that bypass the gastrointestinal tract and requires a needle. Parenteral route of administration are typically used when rapid onset of medication is needed. For example, in emergency, intravenous route of administration may be preferred. Also, there are certain drugs like insulin, that's a peptide hormone. It's unstable in the acidic environment of the stomach. The low pH can cause insulin to precipitate, thus destroying the therapeutic activity of insulin. Therefore, insulin is administered via injection to bypass the stomach. Scientists are exploring protective formulations to overcome this barrier and enable oral insulin delivery that is a more convenient route of administration. Also, it's possible that the patient might be unconscious and cannot take oral medications. In this case, parenteral route of administration might be used. Let's talk about enteral routes of administration. This involves the gastrointestinal tract. Enteral routes of administration include oral, that is the most convenient route of administration, and it utilizes the liver's first pass metabolism. Sublingual is under the tongue, buccal is against the cheek, and rectal. Please note that sublingual is considered enteral route of administration, though it does not use the gastrointestinal tract for absorption, and it bypasses the liver's first pass metabolism. This is because mouth is a part of the enteral system, and that's why sublingual and buccal routes of administration are technically considered enteral. Nitroglycerine is a classic example of the use of sublingual route of administration providing rapid onset, bypassing the liver and directly entering the bloodstream to provide quick relief during angina episode. There are some other routes of administration that are not enteral, that is, they do not involve the gastrointestinal tract, and they are not classical parenteral, that is, they do not involve any needle or injection, and these are classified as other routes of administration. This includes inhalation, nasal, ophthalmic, and topical creams. Let's look at some real world examples across different routes of administration. Parenteral routes require a needle. This includes intravenous, means directly into the vein. It offers immediate systemic action and is used for emergency drugs like morphine for rapid pain relief. Intramuscular means into the muscle. This route of administration is slower than intravenous but still systemic. Example, flu shots or epinephrine may be given via intramuscular route of administration. Subcutaneous is just under the skin into the fat layer. It's used for drugs like insulin, or some of the monoclonal antibodies are also injected via subcutaneous route of administration. Intrathecal is scientifically classified as parenteral route as it bypasses the gastrointestinal tract and a needle is involved. Intrathecal administration means directly into the cerebrospinal fluid. It bypasses the blood-brain barrier and is used to deliver the drug into the central nervous system. It's a regional compartment, however, some of the drug may diffuse into the systemic circulation. Spinraza, an antisense oligonucleotide-based drug used for the treatment of spinal muscular atrophy, is delivered intrathecally. These routes of administration avoid the gastrointestinal tract and the first pass metabolism. Let's take examples of the enteral route of administration. Drugs that are taken orally, for example, Tylenol, paracetamol, amoxicillin, pass through the gastrointestinal tract and liver before reaching the systemic circulation. Sublingual or buccal are placed under the tongue or in the cheek for rapid absorption and bypass the liver. We talked about the use of nitroglycerine for angina. Other routes of administration include inhalation, transdermal, nasal, and ophthalmic. The examples are shown in this table. To summarize, parenteral route of administration bypasses the GI tract and the liver's first pass metabolism. It's fast acting and needs a needle. Enteral route involves the GI tract and other routes of administration does not need a needle or the direct involvement of the gastrointestinal tract. The route of administration is many times chosen based on where the drug needs to act or how fast the drug action is needed. For example, if lung is the site of action, then inhalation might be a preferred route. For eyes, ophthalmic route might be preferred. For central nervous system, intrathecal route of administration may be used as this can cross the blood-brain barrier. Sometimes the speed of action is more important. In case of emergency, severe pain, intravenous offers immediate relief. In case of an acute angina attack, nitroglycerin is delivered sublingually and it acts fast and it bypasses the liver metabolism. Oral route is the most convenient and commonly used route of administration. It's non-invasive and easy to administer. Biologics and peptides such as insulin may degrade in the stomach and need to be given parenterally. The choice of route of administration is a balance between the therapeutic goals, patient needs, and drug characteristics. Let's take a look at the journey of the drug after oral versus parenteral administration. Let's first talk about oral route. The drug is taken orally by mouth as a tablet, capsule, or liquid. The drug passes into the stomach where some disintegration and dissolution of the drug may occur. However, absorption is limited in the stomach for most of the drugs. Intestine, that is the gastrointestinal tract, is where the majority of the drug absorption happens because of the large surface area and favorable pH. After absorption, the drug enters the hepatic portal vein, which carries the blood from the intestine to the liver. The liver metabolizes some portion of the drug before it reaches the systemic circulation, and this is called the first pass effect, which can significantly lower the bioavailability. That means less drug is available and it takes longer to reach the peak concentration. So Cmax is lower, Tmax is delayed compared to injection routes. After exiting the liver, the drug enters the systemic venous circulation. It goes through the right heart, lungs for oxygenation, and then the left heart, and finally through the arteries it reaches its site of action. Now let's take a look at intramuscular and subcutaneous routes. A drug may be injected directly into the muscle or it may be injected beneath the skin in the fat layer. From the injection site, the drug is absorbed mainly into the local capillaries or the lymphatic vessels, entering the systemic circulation and importantly, bypassing the gastrointestinal tract and liver's first pass metabolism. This leads to a faster absorption compared to oral administration. As a result, Cmax is usually higher compared to oral administration and Tmax is faster. After absorption in the vein, the drug follows the same path, that is, into the right side of the heart, to the lungs for oxygenation, then to the left side of the heart, systemic arteries, and finally to the site of action. Another common route is inhalation. The drug is inhaled into the lungs where it crosses the thin alveolar capillary membrane. Absorption from the lung is very rapid due to the large surface area and the rich blood supply. From the alveolar capillary, the drug enters the pulmonary vein, flows to the left side of the heart, then the arteries and reaches the systemic circulation. thus effectively bypassing the liver's first pass metabolism. Inhalation often results in quick onset of action, especially for respiratory drugs. This illustration compares the PK profile for different routes of administration. Oral drugs, they pass through the digestive system and the liver before entering the systemic circulation. They have a longer journey, therefore causing delays, that's a longer Tmax, and potential loss of the drug due to metabolism and hence lower bioavailability. Oral route of administration has the lowest Cmax, a delayed Tmax, and a lower bioavailability. Intramuscular and subcutaneous injections avoid the gastrointestinal tract and the first pass metabolism, and hence their Tmax is often shorter compared to oral drugs, and bioavailability is better than oral drugs. For intravenous drugs, we see an instant peak as the drug enters the bloodstream directly. They have the highest Cmax and the lowest Tmax almost immediate. Their bioavailability is 100% by definition, as the full dose enters the systemic circulation immediately. Inhaled route of administration is usually very fast, often within minutes due to rapid absorption across the alveolar capillary membrane, but it's slower than intravenous injections. Cmax is high, but generally lower than intravenous because only a portion of the drug reaches the systemic circulation, as some of the drug may remain in the lung tissue. This is a real-world PK profile comparing oral and intravenous routes where paracetamol was given at 1 gram. As we see, the intravenous route reaches the peak level almost instantaneously, while the oral route showed a delayed rise in peak concentration due to absorption and liver metabolism. This beautifully illustrates how route of administration can shape the PK curve even when the dose is the same to start with. Let's understand the concept of bioavailability. But before bioavailability, let's take a closer look at the function of the liver. The key function of the liver is to filter the blood coming from the digestive tract before it passes to the rest of the body, therefore removing the toxins and metabolizing the nutrients in the food as well as the drugs. Liver removes toxins and harmful substances from the blood, thus detoxifying the body. Liver is just doing its job to keep us safe. Bioavailability is the fraction of the administered dose that reaches the systemic circulation in the active form. For intravenous, bioavailability by definition is 100%, as they skip the gut and the liver entirely and the drug is injected straight into the blood. For oral routes, bioavailability is less than 100% due to incomplete absorption and first pass metabolism. Bioavailability is written as letter F. It tells us how much of the drug actually makes it to the bloodstream in the active form. For example, if 100 milligrams of a drug is taken orally and only 40 milligrams survives the liver and gets absorbed in the bloodstream, the bioavailability is 40%. To measure bioavailability, we compare how much drug gets into the bloodstream after an oral dose versus an intravenous dose. The formula for bioavailability is shown here. It's area under the curve oral divided by area under the curve intravenous multiplied by dose intravenous divided by dose oral. Let's say we administer an equal amount of dose orally and intravenously. The area under the curve after the oral dose is 200 milligrams times hours per liters, And after the intravenous dose, the area under the curve is 500 milligrams times hours per liter. When we plug these numbers into the formula, we get the answer of 0.4 or 40%. Please note that in this example, dose IV and dose oral were the same and hence it got cancelled. However, dose IV and dose oral may not be same and the numbers need to be plugged to calculate bioavailability. There are many softwares available to calculate the various parameters like Cmax, Tmax, bioavailability, and we often use them in our day-to-day work. In this video, we covered a lot of topics. Let's summarize them. Absorption is the process by which a drug moves from the site of administration into the bloodstream. The classical routes of administration include parenteral, enteral, and others. The choice of route of administration depends on the site of action, the speed with which the action is needed, and the drug properties. Intravenous route offers immediate action. Oral is the most convenient and non-invasive route of administration. First-pass metabolism affects the drugs that are taken orally. Bioavailability is the fraction of the drug that reaches the systemic circulation. Route of administration impacts the PK parameters such as Cmax, Tmax, and the overall absorption curve. Absorption mechanisms include passive, facilitated, and active transport, and we will cover this in more detail in the coming video. We also covered some special routes of administration, for example, sublingual, that bypasses the liver's first-pass metabolism. Inhalation that delivers the drug directly in the lungs. And the intrathecal injection that delivers the drug directly in the cerebrospinal fluid. I have generated a small video using artificial intelligence and by giving specific prompts. Please watch this video and let me know your thoughts. Thank you.
All right, pharmacy students, let's make pharmacokinetics way less scary. Today, I'm breaking down how drugs actually get to where they need to go in the body, depending on how you take them. Let's start with the classic oral administration. Imagine you take a tablet. First stop, the mouth. You swallow, and it slides down the esophagus right into the stomach. Here, some drugs start to dissolve, but the real magic often happens in the small intestine. The drug passes through the intestinal wall and, here's a key move, enters the portal vein heading straight to the liver. The liver? It's like the body's bouncer, deciding how much of the drug gets through. This is called first-pass metabolism. Some of the drug gets metabolized before it ever hits the bloodstream. Whatever survives leaves the liver, flows into the hepatic vein, then moves to the heart. From the heart, it takes a quick trip to the lungs, picks up some oxygen, returns to the heart, and finally gets pumped into the arteries. Now, the drug is cruising through the body and boom, reaches its site of action. But what if you skip the gut entirely? That's where subcutaneous, SC, and intramuscular, IM, injections come in. Let's say you get an SC injection, like insulin. The drug is deposited into the fat layer just under the skin. For IM, it goes deeper, right into the muscle. In both cases, the drug's absorbed through tiny blood vessels, capillaries, and goes directly into the systemic circulation. No pit stop at the liver, no first-pass metabolism. That means more of the drug gets in, and it usually works faster than oral meds. IM injections tend to absorb a bit quicker than SC because muscles have a richer blood supply. Now let's talk inhalation. Think asthma inhalers or anesthetic gases. Here, the drug is drawn straight into the lungs, where it crosses the thin alveolar walls and zips right into the pulmonary circulation. It then heads to the left side of the heart and is pumped out to the rest of the body. Super fast, almost immediate. Let's compare. Oral drugs are slowest to reach their peak concentration, that's Tmax, and the highest concentration achieved, Cmax, is usually lower because of that first-pass effect. SC and IM injections work faster, with higher Cmax and shorter Tmax than oral. Inhaled drugs? They're the speedsters, rapid onset, high Cmax, shortest Tmax. So remember, the route of administration isn't just about convenience, it totally changes the timeline and intensity of drug action. And knowing this, that's what separates a good pharmacist from a great one.